Hi, everyone. Welcome to our fascinating discussion today. I'm Sara Downey, and I'm president and CEO of this fabulous tutoring company called At Home Tutoring Services. We deliver high quality sessions to students all over the nation, both in person and virtually. We deliver academic tutoring sessions, test preparation sessions, academic coaching, and college admission sessions. And as part of our mission, which is to elevate students' academic performances to their highest potential, we work with a lot of professionals. And I'm so pleased to introduce one of those professionals here today, Dr. Jennifer Chang-Tran. And I'm really excited for this conversation because we talk a lot about this when we talk to parents about how best to deliver educational sessions. So, Dr. Chang-Tran, can you introduce yourself? And then we'll get right to the discussion points.
Yeah, perfect. Well, thank you so much, Sarah, for this opportunity. I'm thrilled to be able to speak with you all today about something that I'm really passionate about regarding neuropsychological evaluations. And then a little bit about myself. I was born and raised in Southern California, then earned my PhD in psychology at the University of Iowa. And that's where I really discovered what neuropsychological evaluations were. And then I pursued my pre-doctoral internship through the University of Missouri at their Health Sciences Psychology Consortium, specializing in pediatric neuropsychology, and then completed my postdoctoral fellowship at Texas Children's Hospital there, and then specializing in pediatric neuropsychology as well. And so now I'm the director of neuropsychology here at Bend Health, where we are a all virtual mental health clinic where we provide neuropsychological services and care services. So really some really great comprehensive mental health services there.
Well, as I said, I'm so kind of so excited to talk about this topic today because we do talk to parents of students with different learning styles, different educational challenges, academic challenges, and we really have used neuropsychological services to improve outcomes for our students. So I know you prepared a presentation today, and I'd love to make it, back and forth and kind of chat about your slides, but also I'm going to interject some questions if that's okay with you, and related to hopefully so people who are watching can understand how to use a neuropsychologist to the benefit of their students' academic success. So that's great. Do you want to pop up your screen and then we can just
Sure.
chat along the way? That'd be great.
Most definitely. All right. So then with the slides that I have was really talking about like unlocking the benefits of neuropsychological evaluations and achieving your students' potential. And so what these slides include are like the discussing like what is a neuropsychological evaluation? What are the purposes of it, the process, as well as the ideal candidates for a neuropsychological evaluation, as well as candidates that aren't a good fit at this time for it. And then really also explaining the concept of neurodiversity and really being able to embrace neurodiversity and having those neuropsychological evaluations really informing one's neurodiversity or diverse abilities, and also exploring recommendations following a neuropsychological evaluation, the pieces in terms of what can we do with this evaluation and how can we best support students.
And where we come in as a tutoring company, I have to tell you that we really pore over the reports that are issued and the recommendations from an educational standpoint that are issued in those evaluations are what we rely on and our team of tutors rely on in order to best deliver the content or the way that a student needs to learn based on the neuropsych recommendation. So that's the area that we rely on a lot too.
Yeah, most definitely. And that's something that I feel like with our reports, really putting a lot of detail in those recommendations. And those are informed by our data in terms of the evaluation, see where is a person's strengths and areas of growth, and where can interventions like tutoring can really be beneficial for them.
We love knowing the type of style that a student has, whether they need to see it, hear it, reteach it, whether they just need to hear it, auditory, all those different kind of learning techniques. That's what we really rely on when we try to improve our sessions. So
Yeah, definitely. And so what we think about too is that there's a lot of barriers that families can face when getting a neuropsychological evaluation. Usually, what ends up starting to happen is that they notice some kind of concerns, that there's something that's different, or maybe something that's off. And sometimes it takes a while to get a referral. Sometimes there's like advice where they wait and see, which isn't exactly the best technique because we're losing this time where there can be interventions, tutoring, other academic services, things in a mental health clinic as well. But then once they get that referral, usually can be from their pediatrician or other primary healthcare provider. Sometimes there's a really long delay in terms of being able to get that assessment. There's places that I've been at where an evaluation, the wait list would be up to 2 years. And so we're losing all this time trying to figure out, well, then what? And then once a child really goes through the evaluation process and gets a diagnosis, there can be this greater barrier in terms of, well, now what? What do I do with this? And then if there's wait lists in those services that they need and like academic, mental health, et cetera, services, then that creates even longer barriers and greater barriers as well.
In our experience, a private neuropsychological examination tends to be more comprehensive. And I'm not criticizing what happens diagnostically within the public school setting. It just tends to be a little bit more basic. But obviously, there are financial constraints why someone can't privately pay for a neuropsychological examination. So it's interesting. It's an interesting issue. And as you say, the wait list and the time between
Mhm.
concern and whether when an evaluation occurs is sometimes I mean, it can be an entire school year.
Mhm.
So that's what we see too. So we always try to see if a family can opt for a private evaluation just because the expediency is there
Mhm.
versus sometimes in a different setting. So
Mhm. Most definitely. And then when we're thinking about neuropsychological evaluations, so traditionally they're done in person, they're done in like a brick and mortar clinic. But then technology has been great in terms of now we're able to conduct virtual neuropsychological evaluations. And that has had like a lot of great benefits with that because of it. For example, if we have greater access, so like for example, at Bent Health, we're able to see anyone across the country. And so when we're thinking about places where there's not really any neuropsychological evaluation services, this is where families can really engage in a virtual neuropsychological evaluation. With that, there are also shorter wait times, and then also that convenience for families and children doing it in the comfort of their own home. I know that there can be instances where a family has to drive hours to get to a clinic to get that evaluation done, and then hours back. And sometimes families don't have that luxury of being able to take time off to do that driving back and forth. And then also when evaluations are done in the comfort of their own home, sometimes we can see a lot more as well because they're now in their natural environment too. And then when it comes to figuring out, okay, well, is there a difference between virtual and in-person testing? Well, in terms of research studies, it's shown that there is equalness and effectiveness with in-person and virtual evaluations. And sometimes there can be greater accuracy in terms of those virtual assessments too. And something that we also want to note is that not everyone is a good fit for virtual evaluation. So then part of the process, especially during the initial intake, is to see would this be a good fit for the child in terms of that virtual testing, or would referring out to an in-person would be better.
yes. Can you hear me at all? I'm having some pretty
Yes.
big audio issues. Can you hear any kind of static on your side? You can. Oh,
Oh,
that's
I
my
can hear
computer.
you.
I'm having issues though. Okay.
Okay.
If it's gonna go away or not. Can you hear me okay?
I can hear you. Good. Yeah.
Every time you engage the microphone, it has massive static. So
Okay.
let's terminate and then we'll come back and then start the slide again.
Okay. Sounds good.
So I'm sorry, everyone. We have a little bit of a jumpy recording just because I had some audio and technical issues on my side. So we had to stop the recording and we'll pick up where we left off. So we were talking about the benefits of a neuropsychological evaluation, particularly virtual one. So sorry about that, Dr. Chang-Tran. But sometimes things happen technically, right? So you have to pivot and be flexible. So here we go.
Yeah, most definitely. And completely no problems. Yeah, the joys and sometimes the hardships of technology. So, well, thank you everyone again for your flexibility. When it comes to the benefits of a virtual neuropsychological evaluation, there's a lot of great things that have arisen from being able to do neuropsychological evaluations in a virtual format. And the biggest one would be greater access. And so families don't have to go drive to a in-person clinic, but instead can access it in the comfort of their own homes. And especially with like Bend Health, not only are we able to serve families in one particular state, but we can actually serve in all 50 states. And then there's also shorter wait times because of that greater access. And then also the convenience for families and children, where especially when we're thinking about families in more rural areas, they won't necessarily have to drive like hours away for an evaluation. And sometimes families don't necessarily have that luxury in terms of taking that much time off to drive a few hours to there and then driving a few hours back. And then it also can be really convenient for families in terms of really providing a comfortable environment for the child or the patient themselves because it is in their home. They can wear their PJs. It's completely fine. And so really being able to provide as much comfort for the family and their children as well. Then there's
Sure.
also,
No, sorry.
yeah,
I'm sure a decade ago, it would have been much more difficult to understand or be able to explain that this can be an effective mode of,
mhm.
evaluating. And ever since the pandemic, I'm sure that it's opened up this possibility and people can understand how you can do some of these things virtually.
Right, exactly. And so even with me during the pandemic, that's where the clinics that I was at, we really had to learn like, wait, how do we do this in a telehealth format? And then with the pandemic like subsiding, like we're able to see like, wow, this is a very viable um alternative to like in-person testing. And something that we've also seen too is that when we're looking at research studies, there's been studies that have looked at virtual testing even pre-pandemic, especially when we're thinking about like rural like areas, places where there is less access. And so with pre, during, and post-pandemic, we've seen that the studies have shown that the effectiveness is the same as virtual and in person, or even sometimes greater than that. So we use very similar, if not like the same measures as well. So those are very standardized too. So a lot of great solid uh, efficacy across the board for that.
The neuropsychological evaluation is not treatment. You're diagnostically assessing a student and understanding their learning style, idiosyncrasies, if you want to call it that, and then
Mhm.
giving a recommendation for treatment, not
Mhm.
necessarily. Yes, interesting. Okay. You know, we we're called at-home tutoring services. And so before the pandemic, virtually 100% of our sessions were at home, shoulder to shoulder rather than computer to computer. And then literally within 48 hours, we had to pivot our mode of delivery and go from in person to virtually. And so now the pendulum has shifted back so that we do in-home services for sure. And then we also have a lot of virtual sessions too. So do you do you believe virtual neuropsychological evaluations is okay for 100% of patients? Or do you think that in-person evaluation is better for some? And what would be the difference in your opinion?
Right. Yeah, that's a good question. So virtual assessments can work for many students, but then not all. And so for us, usually there is an initial intake where we help determine, is this a good fit? And sometimes if there's a lot more complexities, um, then in-person testing is warranted. Some things can be in terms of greater complexity would be like much greater neurological, medical complexities and other complexities as well. And so what the virtual testing has really helped is open a lot of doors for many families. And so that also helps reduce wait times all across the board, not only just virtual testing, but in person. So then the folks that really do need those in-person testing can access that even sooner.
That's a good point. We usually let the parents drive whether or not in person or online is the best delivery mode for academic sessions. So interesting.
Definitely. And overall, like a big question is like, what is a neuropsychological evaluation? Like, what is neuropsychology? What is a neuropsychologist? So overall, yeah. And so with neuropsychology, like ultimately we're looking at brain-based like behavior. And so when we're looking at a neuropsychological evaluation, we're really tapping into that, assessing those brain-based behaviors or cognition, um, ultimately a person's thinking skills and what that all entails, like learning styles, attention, etc. And really creating a profile in terms of what are their strengths and what are their areas of growth. And from there, the key takeaways is that we can help provide clinical diagnoses when they're applicable and align with the results. And from there, like the neuropsychological evaluations can be really powerful and really opening up a lot of doors. It ultimately serves as a gatekeeper for a lot of different services. And so when we're thinking about treatment planning, especially with like evidence-based mental health interventions or resources, and then in like the school setting or outside of the school setting, thinking about like educational programming, tailoring academic accommodations, making referrals to academic services and tutoring services, and really being able to take our reports and really tailoring it for that student to succeed academically as well.
So can you give the audience examples of some academic accommodations?
Mhm. Most definitely. So one very common one that we have is extended time. That's really common in terms of like ADHD, sometimes when a child has a lot of anxiety, or if there's like a learning disability or disorder involved, that from our testing, we can see that sometimes the speed of how they get things done may be a relative weakness for them. And so we have this evidence that shows extended time will help them. Other ones is also making modifications to how the test looks. And sometimes something that's also really common is we do testing where we can see, well, with this testing, does multiple choice answers make sense or providing multiple choice? Sometimes it might increase distractibility, especially for individuals with ADHD, that maybe like fill in the blank might actually make more sense. Or having certain visual schedules at the school and at home to help a person transition from one thing to another. Um, Also, some assistance at school involving like maybe an aide or accessing like a school counselor for some counseling services there. Um, in terms of like specialized instruction for a child, modifications in the classroom where they may have like small group sessions or sitting closer to the teacher to minimize distractibilities, et cetera, on that end. And so there's a whole like I could think of like
No, no, right. I guess my what we've seen on our side is that sometimes the accommodations are in place and either they're not executed properly or that the family doesn't know that these things are available, and for them to be an advocate in the school or the setting in which they need to be used in order to be, using them properly. Because I mean, I believe, and you can correct me if I'm wrong, I feel like sometimes some academic systems are stacked against students of different learning styles. And so unless you're in there, like, grinding it out in the trenches as a parent or an advocate in the system, then the student tends to get lost or you're not reaching your academic potential. So we've seen also academic accommodations like taking pictures of the smart board or the chalkboard, having an outline of the unit in order for the student to be able, because there's like a distillation issue of information. So having an outline to orient focus on studying and mastery is very helpful for students. So I always feel like the more creative the evaluator, the person who's writing the neuropsych evaluation, the more beneficial it is for the student. So some of the things you just mentioned are things that I had not heard of either. So that's interesting. I like the fact that you're even more kind of in depth with those accommodations. So
Mhm. Yeah, most definitely. And that's something that we really value in terms of like when we're thinking about the reports, providing feedback is like we gather all this background information, but then the really big takeaway is like, well, what do we do with it? And that's where we really try to make our reports really user friendly in terms of, okay, this is what we spell out. This is what we see diagnostically. This is what we're seeing in terms of strengths. And this is what we recommend, and really making an emphasis on these different kinds of accommodations. And not all accommodations will work. And so that's where it's a lot of trial and error and really seeing, okay, what we're seeing from the testing is showing this. And so we want to tailor those accommodations based off of what we're seeing in their profile.
So, in your opinion, whose responsibility does it lie in order to make sure they're being executed? Because you can have all these ideas, and if the execution is flawed, is it combination of parents and school administrators, the learning specialists within each school? What's your opinion on that?
Yeah, it would be a combination of those. And so usually it's the parent who shares the report with the school, and then having that like IEP meeting, if they're in the public school system, and discussing that. And then there can be like, if necessary, like a special education advocate that can be helpful. And that's something that we can provide as resources, as well as a neuropsychologist to be someone that can really be in like the parents' court in terms of being able to help provide that more. And then also having those periodic like evaluations at school and monitoring their progress at school as well. So then showing that there's more evidence whether those accommodations are helping or if there's tweaks that need to be had for those.
Yeah, because in the school setting, it can be pretty intimidating. You know,
Mhm.
if you're intimidated by the school administrator or the teachers, that can be an intimidating situation. Like, oh, I think that it's in this report, and then you have to not confront people because that sounds negative, but you have to make sure it's being delivered and executed. And then if you feel intimidated by the process, it could get lost. So it's interesting.
Mhm. Yeah, most definitely. And then when we're talking about like who's a good fit for a neuropsychological evaluation, there can be a wide range of um, aspects to that. So then overall, when we're thinking about pediatric neuropsychology, it ranges across different age ranges from children to teens to young adults. And then if there's someone that has like a neurological or neurodevelopmental differences, for example, if there's something in their medical history where there's a neurological condition that they have, or we're thinking about neuropsychology, we're thinking about the brain. So if there's neurological differences, that means there's brain differences, and that can lead to these differences in terms of thinking skills, learning styles, etc. And so being able to assess for that. And then also those academic and learning differences as well, especially if there's things noted from the teachers or things noted at home where like my child has difficulties completing homework or doesn't seem to really understand these certain concepts and we're not sure why. To also those IEP and 504 plan barriers where sometimes like a medical or clinical diagnosis is needed before the school would consider some kind of educational plan for the child and having that educational diagnosis. And then aside from home and school, just having challenges across multiple settings, like out in the community. If there's difficulties where like families are having difficulties taking their child to a public place or public setting, like, okay, what about that? Like let's look into
Yeah,
that. And then also having difficulties with like emotional and mental well-being too, because sometimes there can be these underlying difficulties that are relating to someone's like thinking skills, learning styles, but then it might not be as evident. And so then what can arise from that are these emotional difficulties. And so wanting to look at all of those pieces of providing like a really comprehensive evaluation.
So you're delineating between cause and symptom, right?
Mm-hmm.
Yes. So we usually talk to parents, and there are certain things like what you just said that cause us to say, okay, wait a minute, hold on. Do you need to be evaluated further? Which is things like, are you staying up till midnight to get your homework done? Are you avoiding the work? Are you as a student avoiding the work because it doesn't feel comfortable, it doesn't feel good? And truthfully, usually those students don't have a lot of wins in the academic setting. And so as a human, you avoid things that don't feel good. So to me, those are like keywords that we listen for. Like, wait a minute, you have a student that has aptitude, but there's a gap between aptitude and outcome. So why are you as a student not achieving your potential? And there are reasons for that. So those are some things we look for on our side as well
Yeah,
before we make the referral.
right, definitely. And then there are times where someone isn't a good candidate for a neuropsychological evaluation or not a good candidate for now. And this is where there's a lot more acute mental health concerns that arise that we really want to address those first because we really want to make sure that their health is okay and involving that. So, for example, like substance use issues, like one when we're thinking about like cognition, the use of substances in terms of like illicit drugs, alcohol, etc. If there's a lot of concerns there, we want to address those first, like not only for their safety, but also it can really impact one's cognition too. That it might look like something else. So we want to make sure that those substance abuse or substance use issues are addressed first. Um, if there is a person that's undergoing an acute mental health crisis, like active suicidal ideation, self-injury in recent weeks, or homicidal ideation, we really want to ensure the safety of them and others around them first. So having that mental health interventions first before proceeding with the neuropsychological evaluation. Also with severe psychotic symptoms, if there's active command hallucinations, severe thought disorganization, that would be something that we would want the patient to really get that addressed first, because that is something we want to make sure that they're safe and stable in a like emotional, mental way. Um, and then also severe cognitive impairment if there's severe intellectual disability. So that can be where there's that in-person testing that would make more sense, where there can be more hands-on supports from the team, and really looking at development in that regard. If there are severe eating disorders, wanting to make sure that's addressed first and having the patient stable physically, emotionally, mentally, and that way before we go with like a neuropsychological evaluation. And then when it comes to like child protection, legal issues, or complex custodial situations, this is where in-person testing would be more beneficial because there can be a lot of these nuances that might not be as evident in the virtual setting. And so having someone like such as like a forensic neuropsychologist where they're really looking into those legal pieces would be a better fit for them.
Point is, first things first of this
Mm-hmm.
list, to take care of these issues and then move on to the neuropsychological evaluation.
Mm-hmm. Definitely. All right. And something that we want to really think about is embracing one's own neurodiversity. So this is where we're really thinking about the idea that people experience the interactive world in different ways. There's not one right way. And that viewing these differences as differences, not necessarily deficits, which sometimes makes it almost counterintuitive in terms of neuropsychological evaluation, because when we're testing, we're trying to see who is at the bottom of this curve, who is struggling, where are their concerns involved and really impacting their everyday functioning. And what we want to think about is that we're using these tests to see, okay, there's these struggles that they may be having. And at the same time, there's a lot of strengths. that these individuals have as well. And so being able to see, well, what can we do in tapping with these strengths and really figuring out, okay, like if their learning style is really showing that the data is saying they really benefit in using it in this format, let's really emphasize using that to really help them succeed.
Because it speaks to the idea that with every attribute, there are good and bad aspects to it. Um, don't you agree that over the last probably decade or 2 decades, the ability for school environments to pivot to students that have a different approach to learning has really vastly improved? And I mean, especially in an area like these major metropolitan areas with a lot of options. I'm fascinated with how schools now, and micro schools, whatever, they're able to kind of work around different learning styles in their environment. I think it's a great improvement.
Yeah,
Um, yeah.
definitely. And so it's great that there's just so many options for students now that like there's not just one kind of school or traditional school setting, but there's so many different kinds and really being able to have these certain like classroom settings where it can really be tailored to the student. That's great.
So, and I don't know if this is part of your presentation, and you can table this until we get to it, but what are your thoughts on teachers' different approaches relative to gender? Because we work with students, let's say stereotypically, we have a kinetic male who's not thriving in the classroom, like through pre-K through third grade, because there's this kind of drive to sit still and make sure you learn in this way. What do you think about the different learning styles relative to gender?
Yeah, that's a really great point. So when we're thinking about a lot of different diagnoses, there can be some of these gender differences. And what's interesting too is that when we're thinking about how these diagnoses are formed, so we look at what we call the DSM-5, so the Diagnostic Statistical Manual, and that's where we see these descriptive classifications or diagnostic classifications or criteria. And there can be times where things across gender may be more evident versus others. So there can be times where like especially with children that boys may be more outwardly like externally showing symptoms versus for girls less so. Doesn't necessarily mean that they don't, but it's just a smaller percentage. And so that's something that we think about in terms of neuropsychological evaluations too, that there are times where something I get commonly is, let's say that there's a girl that might have attention issues, but maybe at school might not be as noticeable. And so maybe the teachers might not even notice it. But then we do the testing, we're like, wait a minute, there's
Off the
something that's
charts.
shown.
Yeah.
Exactly. And so that's something that we really have to consider too, where if there's something that just seems off, even when there aren't concerns noted across the board in different settings, it might be worth taking a look at to see what's going underneath there, the surface.
I don't have any empirical evidence of this, but I always feel like the students who are, quote, relatively well behaved and they don't cause any kind of classroom issues, they sometimes fly under the radar. And so some of that stuff is picked up later. This is just, and again, I have no evidence or scientific proof of this, but it's interesting because when I consult with families, I say, well, tell me a little bit about what's the feedback from the classroom about how your student is behaving. And like, oh, she's perfect, or he perfect, there's no issues whatsoever. I'm like, sometimes it's, what is that saying? The squeaky wheel gets the grease. Sometimes the
Mhm.
students that are outwardly manifesting frustration, they get a little bit more attention around academic outcomes. So, and anyway, um, but I'm very, from an educator standpoint, I feel like we're making strides and there's improvements in students with different learning styles being able to be accepted and having and meeting their potential, you know?
Yeah, most definitely. All right. So then when we're thinking about those neurodiverse abilities, when we're thinking about like what is assessed in a neuropsychological evaluation, there's a wide range of things. And so this is some of the more common things that we assess. So when we're thinking about intellectual abilities, we're not only thinking about like intellectual disability, but also gifted and talented or giftedness. And something that we also see with evaluations is that sometimes when someone is gifted, they might be misdiagnosed. And so when we're thinking about giftedness, there's just different ways of developing. So we're thinking, okay, is this something else going on? Or they're gifted, and what can we do in terms of really like honing in on that potential that they have? And then also things with communication disorders, where there might be a language disorder. Autism spectrum disorder is a very common one as well. What they say is that when you meet one person with autism spectrum disorder, you've only met one person with autism spectrum disorder. So there's a wide range there in terms of what autism spectrum disorder can look like. And then also ADHD, and also some complexity that can come with ADHD, where if medication isn't just the only thing that is really helping them, then really seeing, okay, well, what's behind that? What else can we do with interventions to really help them there? And then specific learning disorders like dyslexia, dyscalculia, dysgraphia, etc. And then motor disorders that can also include like tic disorders, traumatic brain injury, and then also other neurodevelopmental disorders where there can be something else in that like medical neurological side that can help explain their current learning cognitive profile. So some of the common ones that I see is if there was a prenatal exposure to certain substances. Also another common one is extreme birth prematurity or extremely low birth weight. Those can lead to these brain development differences, and then also translate to differences in their thinking styles and learning styles as well.
Yeah, it's interesting. Can you go back to the previous slide with just from a kind of a depiction standpoint, a representation standpoint? I always talk to parents like, listen, you have a student that's been, quote, diagnosed as gifted or, identified as gifted. So I always tell parents, listen, if you have a student that's on the far right of a continuum like this, or on the far left of a continuum like this, your need to advocate is that much greater because, the middle is a little bit easier. It's just that you have to make sure if you have a student on the far right of the continuum, let's assume that that's kind of in the gifted spectrum. You have to make sure they're getting the services. You have to make sure they're challenged. You have to make sure that they're, again, achieving their potential. Whereas on the left as well, you have to advocate and make sure they're getting the services. So I always tell parents on the far left and the far right, you've got to be on. You've got to do more than maybe the parent, more in quotation marks, than the parents in the middle from an education intervention or education access situations.
Most definitely. And then something that we can also think about is like twice exceptionality, that someone can be gifted and can have a diagnosis too. And that sometimes, like exactly what we're saying, that giftedness kind of ends up being overlooked in terms of, or the ADHD or other diagnoses can be overlooked because there is that giftedness profile. But then we also want to see that, well, we want to also address things that they might be struggling with too. So maybe there are times where the grades can get impacted by other learning differences that they have that aren't being addressed or really being able to be used as like a strength as well. So then, yeah, looking at that full profile and figuring, okay, how can we best help this child? And have like really foster their,
Yeah, it's
well,
fascinating. Yeah, that's a fun, I'm sure that's a creative part for you. Like, oh my gosh, just love looking at all these students and thinking, okay, how do we reach them? How do we really, what are we going to recommend in order for them to achieve their potential? It's fascinating.
definitely. When we're looking at the different steps for a neuropsychological evaluation, the first part of it is gathering that information, doing the clinical interview with the caregiver, or with the patient. And thinking like, what is going on? Like, what are the goals of the evaluation? Answering questions about what the evaluation looks like. And then also really determining like, one, are they a good fit for virtual testing? Another is, would treatment be warranted for? So like, especially with those like exclusionary criteria, if we're thinking, okay, well, there's something else here, but we want to also like address those mental health pieces first. And sometimes there can be a time where treatment and testing can happen at the same time too. And then once we go to the next part in terms of administering tests, this is where we really do a lot of this hypothesis testing, thinking about, okay, this is what we're hearing is the major like concerns that are being brought up from the clinical interview. And what kind of tests do we need to get like an overview of like a patient's overall thinking skills, but then also really target certain tests to see, okay, do they meet criteria for this like particular condition or this other one, and really tailoring it to the patient. And then we also get standardized information from other people, from like caregivers, teachers, therapists, et cetera, to have that more comprehensive evaluation. And then with
You're
the
gathering
result.
all this, you're gathering all this qualitative information at the
Mhm.
same time. Okay. And then some of the tests that are administered are more empirical, more
Mhm.
quantitative, right?
Definitely. And then with the results, what we do is we gather the results and figure out, okay, what's going on? What is this, I guess, story, so to speak, of what's happening with this child or patient? And so for that, that's where we put together a comprehensive evaluation report and also provide feedback to the caregivers and patient. And then also being able to provide any referrals as needed. So then that really addresses the like, then what do we do for that piece? Okay, and then a big question usually is like, how is this covered? And so there can be various payment options, and this also varies between clinics as well. And so, for example, there's a lot of private practices where out of pocket is the most common one, where families do pay out of pocket for all the costs for the neuropsychological evaluations. There's some where there's different clinics or medical settings or academic medical settings or hospital settings where they might have a mixture of different things with like insurance as well. For us at Bend Health, we do have that mixture of different payment options to help with that increased access. Like getting a family's like insurance eligibility run to see if it is a plan that we cover. And then we also have different like out of pocket, um, like tiers or levels, so to speak, in terms of like the need for the families. And then also payment plan options like care credit can really be helpful for families if they want to pay on more of like a monthly basis for the evaluation.
I've seen cost range from, very little to a lot, a
Mhm.
lot. So yeah.
Definitely. And it's interesting because it's a mix of trying to balance like costs, like for I guess like costs for the families and access. Because usually what we're seeing is traditionally places that take more various payment options like insurance, they tend to have longer wait lists because then they can serve a lot more families versus out of pocket, they can be seen sooner because of that access. And I know for Bend Health, what we try to do too is really try to streamline our neuropsychological process in general. And so that helps with increased access all across the board, no matter whether it's insurance, out of pocket, payment plan, that they can be seen sooner rather than later.
Can you give the audience an idea from start to finish? Okay, I'm a parent and I know that I'm reaching out because I believe that a neuropsychological evaluation is necessary for us to understand my student. So from the time I decide that and I access your Ben Health's website, tell me what's the general, what can the parent expect?
Sure. So let's say that they put in a submission to request an evaluation. And what happens is that they will have a registration call done with our support team. So this is where we get what we call like the onboarding process, like filling out consent forms, like financial, other like paperwork like that, and also like an intake form, and also running their insurance. And so that can be done within days. And then once they're ready to go there, then they can schedule that initial clinical intake interview. And
So that
with,
happens pretty quickly then.
Mhm. Yep. And sometimes there are times where if there are delays, it would be delays in terms of like the family's availability. Like when we're thinking about like spring break, sometimes families prefer to have it done all during spring break. Sometimes it's the opposite, where they're going on vacation. They don't want to go through the neuropsychological,
Yeah.
right? Exactly. So there's a lot of flexibility in that regard. And so, yeah, having it start can be done within like a week or 2 weeks, depends on the family's availability. Um, and then the whole process. So for our testing sessions, we do have shorter testing sessions compared to what might be traditionally occurring in person, where in person it might be a full day. We have hours usually split up to like 1 to 2 hour sessions. And sometimes that can be done scattered throughout the week. Sometimes if a full day does work, then we'll have a lot of those breaks in between. And what's great is that since it's virtual, the family can go grab a snack, eat lunch, come back
Yeah.
to their computer for it. Um, that those like the testing can take maybe a few weeks, maybe sometimes just shorter depending on the family's preference in terms of schedules. And then after that, about 2 weeks in terms of getting the results put together, the report. So ultimately, it can be like as soon as like from start to finish, like within a month. Sometimes a little bit longer if it seems like there's more complexities. But we're able to work in a very efficient manner.
So what would be impediments for why the report wouldn't be issued? Is it because some of the people from whom you're gathering qualitative data, they don't submit things, or if a student misses one of the sessions, those would be reasons for the delay?
Yes. So one of the very common ones is that qualitative data.
Yeah.
Um, and so trying to get the information from teachers. And we realize teachers are really busy too. So this is something that they have to take time out of their day to complete. So sometimes there can be some delays there. And because we're comprehensive, or as like we want to be as comprehensive as possible, sometimes there's multiple questionnaires that they have to fill out. And so it can take a lot of time for
You know what's interesting is that I think also, like, as I've noticed the trends, we've been at this for a while, is that like years ago, there was like a stigma attached to being tested, and there was a concern if I'm a parent and have a questionnaire filled out by a teacher, like, oh, I don't really want them to know that we think that he's struggling, things like that. And I was hoping you could speak to that a little bit to assure people that this is way more accepted, or it's kind of a tool, a very useful tool to use in this kind of idea of helping improve your students' academic outcome.
most definitely, like being able to get information from the school and having multiple settings helps us really provide like a greater picture of what's going on with the student. And even if the teacher isn't endorsing like any concerns, if that happens to be the case, then that also provides us even greater information as well too, because sometimes that's really shown like, okay, maybe these concerns or learning differences are really flying under the radar. And sometimes when that happens, that can really impact someone's emotional functioning too. Because they might be getting the idea of like, oh, everything's fine. But then internally they're thinking like, there's something here. I don't know what it is, but there's something going on.
Dying a
Um,
slow death on
yeah.
the inside. Dying a slow
Mhm.
academic death on the inside. Yeah, I think it's interesting this stigma appears to have disappeared. People are
Mhm.
understanding the value of these kinds of things. So,
Mhm.
and to me, I guess what we see is that it's so commonplace to have
Mhm.
neuropsychological evaluations and to use them to the benefit of the kiddo. So.
Yeah, definitely. Like having that greater access to assessments has been so great for families and yeah, really like embracing that neurodiversity um has been amazing to see. All right. And then when we're thinking about the whole team, like who is a part of the neuropsychological evaluation team? And this can vary from clinic to clinic as well, where there's some that, especially if they're more like a specialized, like private practice, it can be just solely the neuropsychologist. And if so, that's something where they would do everything from start to finish, um, which in some ways can be helpful in terms of seeing everything, like doing everything like one on one with the patient and families, but at the same time, that can also cause some delays in terms of getting the assessments done, or like causing that greater wait list. And so what another common model is having multiple people on the team. And like, for example, like for us at Bent Health, we have psychometrists who have a master's degree or something equivalent, and their training is really like honing in on test administration, and really working really well with families, and like especially with the child or patient, in terms of making them feel comfortable, or if we have to sort of modify how we're conducting the testing, which is also rich information too, that they can really do that too, especially if, for example, what we commonly see is for a child with ADHD, they might get bored really easily, or there might be times where attention is wavering, or there's maybe a lot of impulsive answering. Then what we do is really use like our skills to like sort of modify the testing environment to help. Okay, let's take a break, or like, do we need to do a little movement break, a little dance break, or whatnot, or having those multiple sessions too, having that separate to help like maintain their stamina and attention would be beneficial. And then when it comes to the other providers, the neuropsychologist is the one that really is involved throughout the whole process. So for example, like for me at Bent Health, while I'm not necessarily administering the test, I am involved in the intake process in terms of like, what should we target in terms of asking questions? What is part of this test plan? What do we need to tweak it? What's great about virtual setting is that I can jump in and observe testing as needed at different times. And really we're the ones that make the diagnoses and with like the reports and making the recommendations, et cetera, for that. And then we can also have psychiatrists involved too, where they can provide even a greater holistic point of care. When we're thinking about the like psychological piece, are we thinking like maybe medications might be something that would be a great idea to consider?
Circling back, so a neuropsychologist is always a PhD level practitioner. Okay.
Yes. Okay. Then when we're thinking about like what domains can we assess, we can assess a lot of different domains. And so here the one that's the most common is intelligence, looking at one's own like foundational thinking skills. And then when we're thinking about other ones like executive functioning, we're thinking about like higher order thinking skills that are impacted by these foundational thinking skills. Looking into language, like whether like in terms of like understanding language, speaking, expressive language, and then attention, and then memory and like their learning styles, processing speed, academic performance across like reading, writing, math, adaptive functioning, what a person can do independently on a day-to-day basis, their emotional and behavioral functioning, and a lot more other domains there. And that's something that we also want to think about is that neuropsychological evaluations, it's an umbrella term for a lot of different types of evaluations. And so something that might be commonly used is the term psychoeducational evaluations. And that's something that's like common in the school where they're looking at IQ and academics. And then for neuropsych, it's those and then some for that. And then like psychological evaluations that can be more related to looking at the emotional and behavioral functioning. That's something that for neuropsychologists, we can conduct that too. And one of the other really common ones under this neuropsychological evaluation umbrella is autism diagnostic evaluations, where we still have this really comprehensive clinical interview, doing these clinical observations where it might be like a play-based observation, using standardized rating scales for like the caregivers and teachers, et cetera, and using additional testing as needed, especially when we're like assessing some of those on the left side.
Yeah. No, I was sitting here thinking, my gosh, we could have a daily webinar or conversation about all these domains and their impact on on learning, and how to improve them, how to mitigate anything that's not optimal. I don't know. I just think that, we talk a lot about processing speed and executive functioning. We have an entire team devoted to improving one's executive functioning skills. So I'd love to hear about that in the future too. Like how, from a neuropsychological standpoint, would you recommend to improve some of those things? So yeah, we talk about every domain that's included on this slide or things we talk about every day.
Yeah, definitely. And then that's when we're thinking about um like there's those different domains, like how can we help in terms of improving that? And there's so many different strategies and coaching and so many things.
Except the treatment piece, right? It's not necessarily the
Mhm,
evaluation piece.
exactly, exactly. So then speaking of the treatment piece, like then what? So we have the evaluation, we have the diagnoses, we have these recommendations, but then what you're saying, Sarah, that like the big part is, well, what do we do after? And so with that, we have like what I think of neuropsychology is that we're sort of like specialized generalists where we really specialize in these brain-based behaviors, but we're generalists in that now we're kind of like the gatekeepers in terms of saying like, well, these different kinds of interventions or these kinds of resources are some things that we highly recommend and kind of providing those referrals as needed. So then a big one that's most common is the mental health interventions, whether that's more that like mental health coaching or academic coaching in that sense, to like psychotherapy, individualized psychotherapy, or with the families or parents, um, a wide gamut of those. And then with like developmental interventions, like physical therapy for like motor skills, occupational therapy for fine motor skills and like daily living skills, speech language therapy for like language. Another one where we think about interventions is like ABA therapy. That's one of the most effective treatments when working with individuals with like on the autism spectrum disorder. And then also supplementing with other interventions, and then having like medical or psychiatric consultations, where that could be with like a nurse, mental health nurse practitioner to a child and adolescent psychiatrist. Really thinking about like would medications be a good supplement to these other interventions? And then sometimes medical consultations can involve like are there like possible signs of a seizure? Like maybe seeing a neurologist would be beneficial just to kind of rule out certain things if there's certain concerns that are popping up. And then aside from those interventions, really thinking about the child learning styles in terms of the educational programming with recommendations regarding accommodations and modifications to instruction through like the IEP or 504 plan. And then not only within the school system, but outside of school, like having academic tutoring, having like academic coaching to like test preparation when we're thinking about like ACT, like or SATs, and even like when we're thinking about during college, like the GREs, the MCAT, et cetera, et cetera, et cetera. The list goes on and on for that. And then even when we're thinking about um, when like a student is transitioning onto like post high school, being able to see, okay, what might be some really great options? Would more that traditional like college setting work, or would something else in terms of like vocational rehab? Maybe that might
Job
be.
training, yeah. Great.
Mhm, definitely. And then having resources that we provide from local resources to national resources to provide that greater support. Yeah. Then when we're thinking overall about like with Bentel, um, what I was mentioning earlier is that we really provide a lot of great like wraparound comprehensive care. So not only neuropsychological assessments, but then also mental health coaching that addresses a lot of different things in terms of like I think of it as like mental health tutoring. Like if we want to figure out like different strategies with anxiety or some other things with ADHD or neurodiversity, if there are behavioral concerns or disruptive behaviors, there's coaching for parents too to really help them become empowered in terms of how can I best help my child. And then there's also the psychotherapy, and then also the psychiatric visits with that. And so each care service is really tailored to the child or patient for that. And going off of that, like with Bent Health, we provide like through our care services, like live video sessions with the practitioners. There's unlimited chat messaging with the care team. There's access to parent and caregiver community for that extra support. And then those specific care programs like that coaching really addresses the patient's diagnosis and the family situation. And then there's also a behavioral care manager that oversees all of that, like treatment planning and everything. And for families that are interested, there is care that goes up through the age of 25. And so they can sign up or look more through like the Ben Health website for that. And then with the neuropsych piece, really similar in that with the care piece, people can receive access within weeks instead of being on a wait list for months. And similarly with neuropsych testing, the same as well. And so evaluations can be done from 2 to 25. And we use that patient-centered approach. So that hypothesis testing and really tailoring it to the patient, where assessing someone that's 2-year-old, like is very different than from assessing a 25-year-old. And so we really, really look into how can we best tailor this to the patient that's in front of us.
Mother of a teenage boy, I'm not sure there's much difference between 2-year-old and let's say a 16-year-old, but we digress.
And then we use those validated assessments, very similar, if not the exactly same, like assessments that are done in person. They're standardized, they're norm-based, they're validated. And so really using like gold standard measures, and then also having the results available within weeks, because we know that time is important, time is valuable. And so being able to provide that information as soon as we can.
Love
And then,
the kind of the
yeah,
wraparound approach that Ben
yes.
has, because in our experience, if we refer to practitioners that only do the neuropsychological evaluation, it's like, then what? And then the family's left to try to find and place services according to the report recommendations. And then there's like a little bit more delay or a lot more delay. So I love that it's complete, full service and wraparound. It's awesome.
Yeah, yeah, definitely. And then what's great is that since it's all housed in one clinic or company, so to speak, that there's a lot more like communication that can be done.
Continuity too. Yeah, continuity of care. Yeah.
So, and they'll have access right away to the report. They have questions, then they can always find a direct way to contact me, and then really provide that information for families.
I can vouch for your accessibility too. I can vouch for how accessible you are. Personal recommendation.
Thank you. Likewise for academic tutoring too. And so, yeah, overall, what's great is that we, really try to tailor things to the families and really provide like resources and recommendations for folks that are valuable. I know that there's a number of families that I have recommended at-home tutoring services because there's such great accessibility. And when we're thinking about virtual testing, that usually means that families are open to virtual, like academic services too. So then that has worked out really nicely.
Yeah, I love that there's not as much of a delay as with other, and I'm not criticizing anyone else. It's just that I like the fact that it can be like a little bit more on demand to try to get services, because usually we hear it's more like in the crisis zone. Like we are failing everything, the students' behavior is going downhill. It's really important to get some of these issues addressed immediately. Do you have another slide, or is that the end? Is that
Technically, no, this is it.
well, in preparation for this meeting or webinar, I gathered some questions from some of our clients. I just wanted to talk to you about some of these. So what is the cadence for neuropsychological evaluations? How frequently, once you understand you need to get one as a parent for your student, how frequently, what's the cadence for getting a student evaluated year over year?
Yeah, so it can vary, but usually I would say between 1 to 3 years. So, for example, if we're thinking about that traditional like public school system, usually every 3 years, like a reevaluation is needed to provide updated recommendations. So then they can continue on with having accommodations and or be able to modify accommodations as they progress through school. And then sometimes as soon as a year would be beneficial, especially if there's a lot of things going on. Like sometimes, like well, when I think about neuropsychological evaluations, it's more of a baseline. Like this is where we're at. This is what we're seeing from our data. Let's try these different interventions, and then let's see how much they have helped over the past year. And if there's still some concerns that are rising, maybe there's something else that we need to look at as well. And so 1 to 3 years is usually the common one.
So a lot of what we hear about is, well, let me add something to that. So we do a lot of IC tutoring, private school admissions
Mhm.
exam, independent school exam, and SAT and ACT. So parents come to us with concerns about how their student is have approached standardized testing, and truthfully, they come to us a little bit late because those boards require basically documentation of the need for something like extended time. So, how much lead time in your experience is needed for a neuropsychological evaluation to be on a student's file in order for them to be adequately assessed through those boards?
Oh, that's a good question. I think like enough for mental health, like because of our evaluations being done within like weeks, and then having that information and then providing the feedback and report for the families and then having them share it with the organization or school. I am not completely sure. I think it depends on the school, but I would imagine months in advance. Usually the sooner the better.
I was just wondering from your seat what you've known because it is all over the board. So
Mhm,
sometimes they'll take a really fresh neuropsychological evaluation, or
mhm,
sometimes the evaluation has to be in place on the student's file for at least like one school year and
mhm,
prove that the accommodations that are recommended in the evaluation have been used in the classroom and therefore they're needed in certain standardized testing. So I was just curious what your experience was. We always recommend as early as possible and, but it
mhm,
can't be too stale.
mhm,
From what we've seen, it's usually 3 years at the outset at the max
mhm.
for it to be considered fresh and not stale. So,
Right.
um, one parent's question is, I suspect my child has ADHD. How can you get an accurate assessment if he gets bored or distracted?
Mhm. Yeah, so that's where we really use that comprehensive approach. So we do still do the standardized tests or like those like empirical testing, but then we really tailor the testing environment as much as we can to really help like the child or the student. So if they're being bored or distracted, then sometimes like being able to provide supports in terms of extra prompting. And then if they are getting really bored, taking more breaks. Like let's maybe do something that's more of a preferred task, really being able to tailor that. And then we also gather that information from the different sources, caregivers, teachers, and just our own general behavioral observations as well to provide that information. And so once we get all of those, we also look into the results from those empirical tests to see, is this really measuring what we think we're measuring, or is there something impacting these scores? And then we can kind of weave that pattern or story together, say like, okay, well, maybe these attention differences are impacting how they're learning and remembering things. So that could be why it's explaining these scores are lower than what we may think they are. And then yeah, generally being able to put all that information together, see like is a diagnosis um, a good fit for this student.
So, one of our core values of at-home tutoring services is to approach everything with a spirit of optimism. So, I'd
Mhm.
like to close this webinar or recording with an example from you of how you've seen a neuropsychological evaluation be used for the benefit of a student?
Yeah. Oh, like it makes me think of so many things. Um, like one particular example that I feel like it stands out to me that really made me feel like, oh, I really want to pursue this as a career was during grad school. I assessed, I believe he was like earlier in high school, and there were concerns regarding grades and trying to figure out what's going on. Like ultimately, we assessed him and showed that he had a diagnosis of ADHD. And when we provided that information to the family and to him, it's like, oh, okay. Because then it was like, okay, now I can put a label, like a name to what's going on. Because then he said, like, yeah, I just thought I was stupid and lazy. And I was like, no, 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 no. Like,
So you
and that's
detach
where,
the wagon, detach the wagon. Oh,
Mhm.
I
Yeah.
think I think that's I think that's so common, in
Mhm.
what we work with as well. Well, I really can't thank you enough. I feel like we've only scratched the surface on what you as a psychologist can do with these evaluations, how these evaluations can help, and the benefits that an organization like Bend Health can bring to a family. Can you, for people that are interested, can you put your contact information on the screen? Do you have a slide for that, or
Sure.
can we?
Um, I don't have a slide, but I can see if there is a way to, I see there's an annotate. Is that something? Oh, a text. Okay.
You cannot
So,
ask me anything technological.
so then my own email address is jennifer.changtran@bendhealth.com. And then let me see if I can make this into a different color, or maybe not. Um,
I do like the blue juxtaposed with the green. That's pretty. Maybe not great to see it again, but
right.
from a decorator standpoint, it's good.
Yeah. Let's see. Is there an, oh, I can do, okay, let me put it in black. And we also have a more general email for like if families just have general questions about neuropsychological evaluations, they can contact neuro at bandhealth.com. That
Easy. And do you have a phone number, or do you generally like for people to send an email first, just so it's kind of written and documented?
email is best, especially
Okay.
like if I do get personal emails, I can always forward that on to our support team and they can help with that onboarding process.
Okay, that's wonderful. Would you put our information up there as well, just in case people have
Sure.
information about tutoring services?
Mhm.
So our general inbox is, and I'm going to rely on you to do the annotating because we would be here all day if I had to do this.
Okay. Okay, all right.
So it's info
Mhm.
at athometutoringservices.com.
Tutoringservices.com.
And then we accept phone calls too. Not that you don't,
Okay.
but I'll give that number as well.
Mhm.
844
844.
572. Well, you know what? Let me just make sure. I don't know that I always give out the number. Hold on a second. Because the last thing I want to do is to give out everyone number. Hold on one second. And we also have a 713 number. It's seven one
Okay.
three
Okay.
572 3533.
3533.
And let me make sure I give you the right 844 number. It's 844
Mm-hmm.
572 2487.
2487.
Yes.
Perfect.
That's wonderful. Well, I really, really, really appreciate your time. Um, we will continue to explore these topics, hopefully on future webinars. And again, if anyone has any questions or comments about the contents of this presentation, we'll be glad to answer your questions. So thank you so much, Dr. Chang-Tran. Really appreciate it.
Oh, it's my pleasure. Thank you so much, Sarah, for this opportunity. Take care.